The US government has allocated $6.4 billion to immunise its citizens against the virus commonly known as swine flu. Japan is budgeting $1.5 billion. Most other nations haven't released exact figures, but even the most conservative estimate takes the global pot of cash on offer to over $20 billion. Getting a piece of that is healthy for any pharmaceutical company's business. But UK-based giant GlaxoSmithKline is leading the way, with 22 governments ordering 440 million doses of its H1N1 vaccine at an estimated value of $3.4 billion. The impact on its bottom line is not lost on investors. Since H1N1 was first diagnosed in Mexico in April, GlaxoSmithKline's share price has risen by 36%. To put that in context, stocks of Johnson & Johnson, a big pharma not developing an H1N1 vaccine, have risen 21% in the same period. But 2 weeks ago, Johnson & Johnson announced a $444 million deal to buy a stake in Dutch biotech company Crucell that is working on flu vaccines, ensuring it doesn't miss out on the swine flu bonanza.
It's enormous. I mean, it really goes down into the same vein as, say, Prozac does, or, any other type of drug of that nature, which is very, very specific for what is required. Therefore, I think all the major drug companies are obviously trying to play catch-up with each other.
Relative unknowns are getting in on the action too. Chinese pharmaceutical company Sinovac was the first in the world to conduct clinical trials on its vaccine. Sinovac's share price jumped from $1.67 back in April to a high of $12.65 in September, an increase of an astonishing 645%. Of course, developing a potentially life-saving vaccine is not cheap or easy, and the World Health Organization has to rely on drug companies to do it. But the speed with which they've created H1N1 vaccines has caused some to question their safety and the real motives behind the rush.
The general public doesn't truly understand, what are the real problems of giving the responsibility of developing drugs to a private industry, because they maximize profits, they do not maximize health.
Groups like Oxfam are less worried about the safety of drugs, but rather the business model driving production. For example, a poor person living in the developing world will face much greater difficulty accessing drugs to treat life-threatening conditions like malaria, tuberculosis or HIV than a rich Westerner will have accessing Viagra to treat impotency.
Most of the development of drugs, it's in the hands of an industry who is not serving the majority of the world population.
GlaxoSmithKline and Sanofi Aventis have already agreed to donate 150 million doses of H1N1 vaccine to the WHO for distribution to countries who can't afford it. Dan Nolan, Al Jazeera.